hepatitis B. You ask any doctor on the planet, what's your high-risk group? IV drug users, people that are promiscuous, prostitutes, etc.
Yeah.
Healthcare providers. We also know that when you take the hepatitis B vaccine, it's a cycle of 3, a series of 3 that are given usually 3 to 6 months apart.
Right.
Okay. Now a baby's born, and the baby is born, and the immune system is not fully developed, depending on who you talk to, between 2 years and 14 years of age. So at least up to the first 6 months, that's one reason it's so important for breastfeeding. You've got the IgM antibody, that's immunoglobulins that are actually from the mother coming to the baby through the placenta to help with immunity. Why is that important? Because the immune system is not capable of mounting an immune response or even understanding what's going on because it's still being developed. So minimum 6 months, maybe up to a year before it even starts to develop. 1 to 2 years is the developmental phase, but depending on which research you talk to, it can take up to 10, 12, 14 years before it's fully developed. So now why do we give a vaccine? We give a vaccine so that we introduce a pathogen or attenuated pathogen or some signal of the pathogen so that the immune system becomes sensitized to it so that in the future, God forbid, if the child is exposed to that, they have a defense already ready to go. Mm-hmm. If I'm going to give somebody something to train their immune system, but they don't even have an immune system that's working, how does that work? Their immune system can't even seroconvert till they're 2 years old or a year and a half old or a year old. So why are we giving them the first day of the planet? That's the first problem. Secondly, it's got substance in there like aluminum and nickel and formaldehyde and mercury and DNA addicts. We're introducing these foreign things into the body, which the body's, remember, going to react to anything foreign, but the immune system isn't capable of it at that point in life. Next, we're giving something that we know is going to affect promiscuous people, healthcare providers, and IV drug users. And we also know that every 10 years, it needs to be redone again, and it's a serial of 3 shots. So are we seriously concerned that our newborn baby is going to become a prostitute, a drug user, or a healthcare provider before they turn 10?
Yeah.
So what's the reason for doing that? It's idiocy at its height.